Hello, my name is Wendy Love Edge, and I'd like to welcome you to the Bulldozer Health Show. In this episode, I'll be speaking with Susan Meehan, whose daughter Cindy May is being treated with medical marijuana for Dravet syndrome epilepsy. So, Susan, tell me a little bit about Dravet syndrome and epilepsy.
Dravet syndrome epilepsy is characterized by a set of symptoms, and those include that the seizures usually start after a significant illness or after vaccination, which is the case for Cindy May. They started the day after her third set of vaccinations. And they are very difficult to control with pharmaceutical options. Cindy May failed 23 different anti-epileptic drugs.
Oh my goodness.
And they typically are so devastating that they impact the child's development and cognitive status, which they have. Cindy May is significantly delayed for her age. She just turned 13.
Okay.
And the medications are also devastating to the child's development. They put these kids on very strong benzodiazepines, barbiturates, and very high doses of very debilitating pharmaceutical medications.
Right. So when you say that Cindy May failed with the pharmaceutical drugs, what exactly do you mean?
She was put on a medication to help to hopefully help to control her seizures. Most of those drugs made her worse and made her seizures worse.
Wow.
Some of them took away her ability to walk, talk, and eat, and basically live, and still failed to control her seizures. So basically, even with the 23 different AEDs and combinations of those AEDs, they could not find a combination that allowed her to live and controlled her seizures. We never gained seizure control on the typical AEDs.
Wow. That must have been devastating to you as a mother and, of course, to her.
It was awful. She's our first child, our youngest child, youngest girl of 4 girls, and it was devastating to see her go from a normal 3-year-old who didn't qualify for Birth to 3 services to basically in a wheelchair by the time she was 11 years old.
My goodness. So tell me what you decided to do instead of these pharmaceutical drugs.
In consultation with her neurologist, after failing all those medications, a couple of specialized diets, and neurosurgery, he basically told us that he really was out of options and that we should get her to a state in which we could try medical marijuana with her because there just wasn't anything else for typical medicine to offer us.
So where you were living in a state where it's not legal, though the doctor...
Correct. We were living in the state of Connecticut, which in 2012 passed medical marijuana for adults only. It's one of only 2 states with legal medical marijuana that restricts the age to 18 and over. Delaware and Connecticut are the only 2 states that do that. So in the end of 2013, November 2013, we moved Cindy May to the state of Maine, which has had a medical marijuana program since 1999.
And so you moved to Maine, and she was legal to use the medication. And what happened next?
We met with a doctor, and we got her legal paperwork, and we started off with a couple of strains that were high in CBD, and we gained some control of her worst seizures, her generalized tonic-clonic seizures, or GTCs, but we were actually seeing an increase in some of her myoclonic drop seizures, which are a very dangerous seizure. They only last for a second or 2, but they usually are such a harsh jerk forward that they drop a person to the ground. So they're very dangerous because they can get hurt easily. So we ended up trying a few different strains. Maine has a great system of medical marijuana caregivers and who grow different strains and specialize in different options. So we ended up trying something called THCA, which is the acidic form of THC. It's the precursor to THC. Basically, if you don't apply heat to marijuana, you have this substance in it, or this cannabinoid called THCA, or acidic THC. And that is the primary component that controls Cindy May's seizures today. She's down from having, she used to have 1 to 4 bad seizures or generalized tonic-clonics a day and over 1,000 myoclonic jerks a day. And she's down to where we don't see any myoclonic jerks, and she has a breakthrough generalized seizure about every 23 days or so. It seems to be about 20 to 23 days. So her control on THCA is phenomenal. And we actually use THC as a rescue medication instead of the typical pharmaceutical rescue medications, and that has been amazing. It stops seizures within seconds. It's quite phenomenal.
That's quite amazing, the difference. I'm not sure everyone understands what CBD is and what THC is. You explained a little bit, but in the beginning you were saying that the initial marijuana medication that you used was high in CBD but wasn't working. What does that mean exactly?
Right. CBD and THC are 2 of about 80 cannabinoids found in marijuana. And the different strains of marijuana have different ratios or different levels of CBD or cannabidiol and different levels of the THC, which is the other primary cannabinoid, but those are only 2 of about 80 cannabinoids found in marijuana. Those are the 2 that are the most well-known and the most studied. So CBD is the cannabinoid that's found in strains that are popular in Colorado, such as Charlotte's Web, and it's found in a strain in Maine called ACDC. And THC is the thing that most people seek if they're seeking to get high. However, if you don't apply heat to marijuana, you have the acidic form of THC, which actually doesn't make a person feel high, quote unquote. But that's not like a primary, when you're treating someone with as life-threatening, a debilitating disease as Dravet syndrome, epilepsy, you have to consider the drugs that they've put these children on, such as Valium and Onfi, are very, very powerful sedatives that usually drug these children to a almost comatose state. When Cindy May moved to Maine, she was wheelchair-bound. She runs again, she walks, she hardly ever uses a wheelchair.
Wow.
It's really only, we might take it into an amusement park just in case she has a seizure and we need to get her out.
Right.
But she's no longer wheelchair bound. She's walking, talking, running, playing, riding roller coasters, like any normal 13-year-old.
When you brought up about the THC, and there really is such a stigma attached to marijuana, and because of the THC and the fact that one may get high from using the medication, people think that it shouldn't be for children. But you bring up such a great point in saying that the pharmaceutical drugs cause so many other ill effects to the child. It just doesn't make sense that people are concerned about that issue.
Absolutely. Nobody was concerned when they fed my child Valium and made her nearly comatose. A medication called Versed caused her to go into cardiac arrest 4 times.
Oh my gosh.
The 4th time was in February of 2014, and that's actually when we started using THC as a rescue medication at our neurologist's recommendation. Once we saw how fast THC worked and how little effect it had on Cindy May's composure, she recovers from a seizure treated with THC in a few minutes versus a few hours when it's treated with something like Diastat or Valium, which is a pharmaceutical medication used to treat a breakthrough seizure. So that would put her down into a comatose-like state for 4 hours, where THC stops the seizure within 15 seconds, and she's up and talking and back to her normal activities within a few minutes.
And you can't argue with that kind of result, you know. What do you
can't.
think?
We've used it in a hospital setting and amazed an entire room full of doctors who can't believe what they're seeing and want to know what we're using to stop that seizure.
Right. What do you think it's going to take to change the laws? I mean, I think that it is really criminal that you would have to move your family from your home to go to another state in our country and deliver a life-saving medication to your child. What do you think it will take to make the changes that need to be made?
I think it's going to be. I think that we've come a long way, but it is going to be a long road. It's probably going to take some more profile cases of parents being arrested for treating their children, which has happened. And I think that it's also going to take Americans insisting on their rights to this substance, to this medication, and to this plant, and insisting that it no longer be held hostage by the laws of prohibition that have made it such a stigma and such a ridiculous criminal offense to be in possession of it or to be using it as a medication,
Right.
which should be our right.
It should be all right. I am a legal medical marijuana user in Massachusetts, and if I travel, I have to choose between being a criminal if I'm in a state where it's not legal, or having my medication, which really saved my life also. So I understand, and I applaud you as a mother that you took this step for your daughter.
Yes, I absolutely am for the end of this prohibition of this. And, you know, I've come a long way even in my own vision. I was always a proponent of medical marijuana, but the more that I see how much prohibition has harmed our society and harmed our people, the more I'm for full legalization or full the end of prohibition.
I agree with you. Yes, we should be able to grow our own medicine. We should be able,
Absolutely.
everyone should have access to something that is so healing. And thank you so much for joining me. And I'm so happy to hear that Cindy May is doing so much better in Maine with the medical marijuana medication.
You're welcome. It was my pleasure.
Bulldozer Health Incorporated is a 501c3 nonprofit organization and healthcare reform initiative. You can find us at bulldozerhealth.org. Take back your health, America.